I am very disappointed that the Congress went on recess before actually agreeing on what they would do to put the resources into this fight. And I really am hoping that they will pay attention. In fact, I would very much urge the leadership of Congress to call people back for a special session and get a bill passed.
Well, the various comments and quips about the presidential election buzz around and inside our heads like so many drunken flying insects. The reality of what our proboscis-armed denizens are doing in various parts of the Southeast should be a lot more front and center in our discussion. Then again, it's fair to say that we are like so many other nations, perhaps more so than others, who don't do much of anything until it becomes a crisis. Therein lies the Zika spread here in America. What to some people is absolutely no big deal. Others believe it's a government-laden conspiracy to infect us with organic nanites that will force us to make ill-informed decisions at the ballot box come November. Again, to be fair, it's somewhat humorous to consider some people could make any more bad decisions based on their screeching and whining about certain candidates, but that's another story. Let's not fly away so casually from the matter at hand, which includes the expected discussion of government monetary interference, the underestimation of what was going to happen, the ridiculous thinking of those who subscribe to a conspiracy theory, and what is certainly anything but a conspiracy. But we are taking all of this much too mildly. Why aren't we better prepared? How scared are you about living in the age of possible pandemic? We'll talk about that and a whole lot more. Welcome back the Newsmax health editor, co-author of the wild bestsellers such as the ObamaCare Survival Guide, the doctor, so to speak, as he is not a real doctor but knows a heck of a lot more than many of them do. I said that. The doctor, this doctor, is in with Nick Tate. Good to see you again, buddy.
Good to be back, man.
Had to make that was very clear right there. Okay, but let's get down. Let's see if we can put Zika on the operating table here for a moment.
Yeah.
The bad news is that we now have a Zika case in Texas, which means it has now gone from someone who was in Florida, was bitten, then winds up in Texas. This is going to be in every state in America sooner or later. Yes?
Absolutely. I mean, it changes the game that we now have locally transmitted cases of Zika. This isn't a case of somebody traveling to a place in the world, third world country, where the virus is endemic. It's happening here. We've got several dozen cases in South Florida. Those numbers are growing every day. There's a couple of new ones. And somehow, Congress is in recess without having decided that this is requiring anybody's attention. The longer we wait, the more this will spread like wildfire and the bigger the problem we're going to have.
Here's the one side of it, though. People will say, thank you so much, Nick, for telling us that. But we've heard as the general public that if you are not a pregnant female, then it's not necessarily a big deal. Don't worry about it. That's wrong.
It is wrong. The preliminary research shows that, in fact, birth defects have been primarily the focus up until now. Women who are pregnant, bitten by a mosquito, carrying the virus, it can cause birth defects in the child that cause very costly care throughout that child's lifetime, which we can talk about in a moment. But the more research that emerges, the more we find that there are possible neurological problems. People can have swelling of the brain and the spinal cord, which can lead to memory problems, thinking problems. And there's even a concern among some that Zika, which is relatively new to this country and we're just learning more about it, might in fact cause a kind of dengue fever-like reaction where the first time you're bitten and infected, it's not a big deal, but your body creates antibodies to it. So the next time you're bitten, it becomes a much bigger deal and could lead to death, bleeding in the brain, and other problems. So the more we learn about it, the scarier this virus is, and the more we really need to focus on it.
Now, we saw some video a moment ago of the airplanes. We've seen them here in South Florida many times that are flying over the Wynwood neighborhood near Miami. And there are people right now screaming. They're saying, you can't do this to us. You're poisoning us. You're killing us. The mayor of Miami said, wait a minute, we've been spraying in Florida now for decades. This is no big deal. But it would seem to me that this is a lot more concentrated and maybe a lot more necessary.
Well, sure it is. I mean, and this is a classic case, as you suggested at the outset, Ed, of we've waited until it became a crisis. And so now we're responding with these very aggressive, questionable techniques. Giving people more doses of pesticides is certainly not the best way to try to...
But is it because, I hate to interrupt you here, but is it because we've reached the point where we have no other choice than to take this sort of additional spraying, if you will?
Perhaps, but always, you know, an ounce of prevention is always worth more than a pound of cure. So had we done things to prevent the spread in the beginning, had we paid more attention, Congress still is not acting. There's still gridlock in Washington among lawmakers and bureaucrats about what to do. So now we're looking at carpet bombing, fire bombing with pesticides. We're looking at introducing genetically modified mosquitoes into the environment, which may combat Zika, but might introduce all kinds of consequences that we're really not yet aware of. So they're talking about, they're now limiting the blood supply, blood donations, to keep virus from spreading in the blood supply. What we find every summer is there are shortages. Those lead to real and significant problems down the road, some of which might have been headed off by an aggressive effort up front to prevent the spread of
Why
the
do I get
Zika.
the feeling that genetically modified mosquitoes are, again, one of those last-ditch sort of things? Because it's nothing new. We've been doing this for years.
Sure. The problem is that what that allows for is higher levels of pesticides and chemical introductions that can cause problems down the road. There are so many questions about these after effects. And the truth is that caring for people who are affected with Zika, including unborn children, is very, very costly, a lot more than taking the steps to prevent the spread of this virus. And I just fear that, that lion's out of the cage, so to speak.
Couple of minutes we have left here. Once you get sick, you have to get medical care, which means you have to go to the doctor, which means you likely have insurance. Here we go. Aetna is now pulling out of all but 4 states where they currently sell plans on the ObamaCare exchange for 2017. They've made it very clear. Unsustainable losses.
That's right.
They're losing too much money.
Right.
Didn't we see this coming as well?
We did, and we've been talking about it for years, how the Affordable Care Act is really becoming an unaffordable care act. Now, Aetna's following Humana and United Healthcare, the 3 main insurance companies in this country, who are pulling out because they say that they cannot cover the costs of covering people who are signing up under Obamacare. That's leaving 250,000 Americans or so with no insurance. Remember the president's promise, if you like your health insurance, you can keep it?
Your health insurance,
Not for those folks. And what those individuals are going to find, as we are all going to find, we've just learned this week, the new insurance rates for next year are out in all 50 states. We're looking at about an 11% premium increase if you can find insurance that you like. That's a national average, and in some states like Texas, Missouri, and Oklahoma, we're looking at between 34% and 60% premium increases next year. So fewer choices, more costs, all the things that the critics have been saying make Obamacare and the Affordable Care Act a misnomer are really coming true.
I only got about a minute left here, but how do you then, and I'm not putting you in the Obama administration's case here now, but how do you then justify this, where you've been telling people you can have affordable insurance and it's just not there?
Well, proponents would argue that there have been some benefits, and there have. 11 million people have insurance that didn't have it before. People who were uninsured, underinsured, or uninsurable because they had previous pre-existing conditions can now get insurance. But the truth is that we're all now paying more for it. So what we really need to see is either the Republican replacement alternative to repeal and replacing Obamacare, or some coming together of both sides, the moderates. I know I'm dreaming when I say this.
You really are.
I am. To say these
right
things work and let's keep them, these things don't, let's get rid of them. Here's the truth, though. The next president, whoever he or she may be, come January, is going to inherit an enormous problem, and that's health care costs that are spiraling out of control. What are we going to see the White House do about it come January? And that's my question at this point.
And you will pay more money. Let's just
put
it that. Walk away from that.
No question about it.
Now, a reminder once again, everybody, don't forget, co-author of the ObamaCare Survival Guide. Make sure you pick up your copy now because, frankly, you need it more than ever before. Read more from Nick Tate by going to Newsmax.com and clicking on the Health tab. You can find it all right there, what we have discussed and what he is covering on a regular basis. Thanks so much, my friend. Always a pleasure
Thank
to
you.
see you. We'll talk to you again real soon. That's it. We're out of here. Rock on, true believers. See you tomorrow.